And welcome to EcoMap, the practical, easy, and above all, useful ultrasound for general practitioners. Today we're talking about gynecology. So many of you have asked me for clinical cases in gynecology. Well, here you go. Here's a clinical case for you. Let's take a look at it together. As always, don't forget to like the video, give me a thumbs up, and leave a comment. All of that is super important. Every time I read your comments, I always feel really motivated. It makes me really happy. I honestly get some really wonderful comments. Really, truly, thank you all so much. Means a lot to me. Please keep it up. And if you're on Facebook, same thing. Give it a like. Subscribe to the Facebook page. And let me know what you think. And don't hesitate to comment about the clinical cases you'd like to see covered. So these are always real and authentic clinical cases. That means I have no control at all over what will come up in the consultation or what will be presented. But on the other hand, maybe it could also alert me to things that to me seem maybe a bit simple, or maybe things I wouldn't specifically want to cover, but that you actually want to see. Maybe it can still help guide my choice a little bit when it comes to clinical cases, because during a week of consultations, there are a lot of patients, so obviously I can't cover everything, and there are still a lot of interesting things for us to look at together. As usual, your introductory ultrasound training is free. The link is in the description. I invite you to click on it and join me. It's free, it's offered to you. Training to discover the impact of artifacts, what we can do with ultrasound in general practice, what it can bring to your work, who can perform ultrasounds, and so on. We also talk a bit about what kind of diploma you need, etc. A good introductory training, including how to properly set up your device. Not just because you have a nice image, it doesn't always mean it's a good diagnosis. A poor image also means you risk completely missing something and making incorrect diagnoses, whether they're false positives or false negatives. So I encourage you to join me in this training that's being offered to you. So today's clinical case actually isn't really a case at all. Honestly, I was in the middle of making a video for a urology training that's coming out soon. So as part of this video, I was actually doing some practice. Thank you very much. These are practice moments where I really guide you step by step and do the exam at the same time as you. And then I actually noticed that this patient, who had kindly lent her abdomen for the practice break, actually had an IUD. And it was an IUD that wasn't a copper IUD, but a hormonal IUD, which is often much harder to analyze than a copper IUD. And I thought it would make a great clinical case to show you how to measure and check its positioning. Of an IUD on ultrasound, you'll see it's interesting and it's easy. Be sure to watch the video all the way to the end because I made 2 slides for you. Summaries that really cover the main criteria. The first slide is about the positioning from the video. And the second one sums up the measurements, the latest measurements from professional guidelines, at least here in France, about whether it's well positioned or poorly positioned. All right, I'll leave you now with this training video. So we're going to check the positioning of an IUD in this patient. She has a hormonal IUD, a Mirena-type, which is definitely harder to see than copper IUDs. We'll start with a sagittal suprapubic scan. Basically, we're going to check the position suprapubically. We're not going to check the IUD's position endocavitarily, but rather suprapubically. You'll locate your bladder, and just behind the bladder, you'll find your vagina, the cavity. Here, usually with a lot of artifacts, a pretty artifacted image, the cervix is located here. Let me remind you that behind the cervix, you have the pouch of Douglas, and that's where you'll look for any fluid collection, right here. And here we have a uterus that is antiflexed, so it's naturally closer to the probe, making it easier to visualize and assess, of course, than a uterus that would be retroflexed. So, as you can see here, our uterus, let's adjust the image a bit, recenter it, decrease the depth, fine-tune the image, adjust the gain. I'm going to push a little further. The arrow, there you go. There are a lot of settings. You need to know your machine. If you want to perform a proper exam, you have to know it. All the settings, every aspect of your machine. So there you go. The image will be perfectly suitable for the examination. And so what we're going to do is try to identify. We're going to try to spot here in our uterus a hyperechoic image with a posterior shadow cone. On the more recent models, you can actually see the hyperechoic image quite well. On the older models, you might only be able to see the shadow cone. We're going to do this together. What we're going to do is simply sweep with our probe just from right to left to scan the entire uterus from right to left. See, we're going to sweep, sweep, sweep our uterus until we spot those hyperechoic images that we can see very, very clearly right here. And so these hyperechoic images, we're actually going to try to measure them. So that's going to be the first part of positioning our IUD. We will measure the distance between the hyperechogenic image, the one closest to the uterine fund, and the uterine fund. So this will be our very first measure. You can see here that in principle, our IUD ends here. We're going to freeze the image. So I'm going to measure the distance between my IUD. In the bottom line, Eastern, here we have 14 millimeters, which is very good. Up to 20 millimeters, you have a correct positioning of the IUD, since it'll be located in the uterine fund. That's it for the first measurement. And the first exploration of the IUD's position. Second measurement, of course, is to check that the IUD is in the endometrium, properly located in the cavity, in the empty space of the uterus. And that it isn't, for example, stuck on the side laterally in the myometrium. So what we're going to do is rotate around our structure. We're going to turn the probe to get a cross-sectional view this time. In this cross-section, you can see the arms of the IUD appear, both arms of the IUD, the right arm here and the left arm, with the central part of our IUD right here. And we're simply going to check on a cross-sectional view that our IUD, first, that the arms are fully open like here. You can see that our arms are nicely open at the fundus of the uterus. And we're also going to check that our IUD is centered within the uterus. So, for example, we don't have an IUD that's poking out over here, completely off to the side, which would have perforated the myometrium when the IUD was inserted. Here, we have an IUD that's perfectly centered, very well positioned here in our uterine cavity. You can see here we have the endometrium and here the myometrium. And so you can do this if you want. You can take another measurement between the arms of the IUD and the fundus of the uterus, so also in the transverse view. You can see that we can still see it pretty well. Even though this is a hormonal IUD, so it's not the easiest type of IUD to visualize. If you compare it to pure copper IUDs, which are much easier to see, you can see that overall, it's still quite doable, pretty easy, and works well. Of course, it will depend on the patient, whether the patient is echogenic or not very echogenic. It will also depend on the position of the uterus. Is the uterus more anteverted, anteflexed, or retroverted, retroflexed? That can change things just a little bit. But as you can see here, overall, it's not necessarily something very difficult, especially since all you have to do is take, so I'll repeat, a measurement in the sagittal plane. So here you can see the upper end of our IUD, here the lower end of our IUD, It's in the lengthwise position, so it's located like this. And then take a cross-sectional view this time to check the centering of your IUD. So that's it for an initial suprapubic exploration of IUD placement. Now, I told you we'd talk about the criteria, and I've put 2 slides together, so here's the first one. So what are the ultrasound criteria? So to sum up proper positioning, you should understand it by now, because you've watched the video, so these things should be clear. So 5 criteria. The device must be in the uterine cavity, close to the fundus. We'll look at this a bit more on the next slide. As for the measurements, I recommended 2 centimeters, and we'll talk about that. So the device should be close to the fundus. The stem should be aligned with the fundus, meaning in line with the endometrium, obviously, in line with the uterine cavity. We saw this in the video as well. The lower end should also be above the cervix. We saw this in the video. This device should not be embedded in the myometrium, so it must be centered, of course. Here, you can already visually check in the transverse view if your device is centered. You can also simply take a measurement. For example, measure the distance between the right side of your uterus in the IUD and the left side of the uterus in the IUD, and check that both measurements, the right and the left, are symmetrical. So this is to check the symmetry of your intrauterine device. And then with the arms deployed, as we also saw, with the arms deployed, obviously, toward the uterine strings, that goes without saying. As for the measurements of the device, there is no strictly established threshold. It's a matter of professional consensus. We're also going to talk about another measurement that can be taken. Currently, the professional consensus is 27 millimeters. I recommended 2 centimeters to you, which gives you a margin for maneuver, a safety margin. I think in general medicine, you shouldn't hesitate to have a safety margin. We're not necessarily ultrasound specialists. And if you reach that margin or have any doubt, I think it's essential to refer, in that case, to a specialist who can maybe double check the measurement, this time using the transvaginal route so as not to pose any risk to the patient, whether it's the risk of complications or the risk of pregnancy. There's a second measurement, which is shown here on this slide. It's the measurement between the dew and this time the myometrium. It's harder to see with the suprapubic approach, and also harder to see if your patient is obese, but on the other hand, it also has its advantages. In cases of fibroids or multiple pregnancies with increased myometrial thickness, it helps to get around this obstacle. And as a result, you can be really sure of the position and relation to the uterine fundus. Here, once again, I think this is a measurement that it's more within the realm of the specialty, even though it's doable. You can raise the standard of quality in what you do. There's absolutely no limit in general practice to raising the standard of quality. In fact, these are measurements that I myself are going to try soon when checking the placement of my IUDs. But on the other hand, I also think that in general medicine, you have to know how to keep things simple and reliable. So that's why I still recommend to you the 2 centimeter measurement from the fundus, and thank you. When you reach that measurement, refer to a specialist to get a second opinion, which is something very safe for your patients. So I hope you enjoyed this clinical case, this very practical gynecology case that will really be very helpful to you, especially. If you insert IUDs, it's quick, it's informative, there aren't many pitfalls, and there's only one measurement to remember. It's actually pretty nice. As always, like the video, leave me a little comment. I love your comments. They always make me happy. Really, it makes me very happy. Thank you all. Same thing on Facebook. Hit the like button. And as always, check out your training, the Open Ultrasound course. Go take a look, get some info, check it out, see what it's like. It's free. And then see if it's something you're interested in or not. I'll see you soon on EcoMap. Bye.